This is a fun show today. With this conversation that I had with Dr. Justin Dubin, I learned that male porn stars actually have erectile dysfunction. We also learned that these telehealth TRT clinics can be more harmful and cause more damage than good. Today's conversation is with Dr. Justin Dubin. Dr. Dubin is a trained urologist and andrologist focused in men's health at Memorial Healthcare Systems in Miami. He focuses on male sexuality, Peyronie's disease, and testosterone treatment. In addition, he has his own podcast called The Man Up, a Doctor's Guide to Men's Health podcast. With Dr. Dubin, we talk about porn stars. And he wrote a paper on this. This is not something that he's just coming up with. He wrote a paper, and he also did an experiment where he called several clinics, TRT clinics, told them there's his situation, and which was obviously fake. And most of them actually recommended TRT, testosterone treatment, without him probably needing it. Today's conversation with Dr. Justin Dubin on male porn actors and TRT clinics and more. Let's go. Welcome to the Dr. Geo podcast. I am your host, Dr. Geo, where it is my intention to help you improve your prostate health and live better with age. Such a pleasure to have our guy here, Justin Dubin. Justin, thank you, man. On a Saturday, you live out in Miami. You know, you could be out on a beach somewhere. Here you are. Here you are, the podcast with me. I appreciate you, brother.
Don't worry, I'm going to the beach right after.
Yes. I figured.
Yeah.
I figured
I'm
as
hitting
such.
the
I mean,
beach. I'm hitting the
if
beach.
you live there, come on. Yeah, on a Saturday, absolutely. Thank you
Got
so
to,
much for
man.
being on.
No, my
Justin,
pleasure. I'm really excited to be here.
thank you. Thank you. You know, we talked about it before the recording. It's like, yeah, I know. Of course I know Justin Dubin. Wait a minute. We never actually met. Wait a minute. This is only through social media. Oh my God, this is the first time I actually get to meet Justin Dubin. So it's like one of those weird things with social media where you think you actually know people and
Yeah,
you
no.
never actually met. So it's such a pleasure, brother.
Absolutely a pleasure, man. I've been following you forever too. I mean, it's like our paths never truly crossed, but we've been there. And it's great to finally connect in real life. Well, not in real life, but at least talk to you like this.
It's as close to real life as possible. You know, with AI and everything, it will be real life.
You're right. You're
You
right.
know, digital life and real life will be one probably. So so I follow you also on Instagram, and then you posted something, and it prompted me to say, all right, hey, do you want to get on a podcast? So you did an experiment where you called a couple of TRT and anti-aging clinics, and I know you have a lot to say about that, and you kind of said,
Yeah.
look, this is what I have, and it's not, and what you presented to them that you have was not something that potentially, and you'll expand on that, where you need TRT, but they say, yeah, absolutely, we'll we can help you, and so tell me more about that experiment and expand on the problem. Look, you're down in Florida. Man, there's
Oh
an
man,
anti-aging clinic like in every other corner.
Oh my God, it's
And I
crazy.
think what you and I are afraid of is, and I've seen this, right? I've seen this because then patients come to me and I look at their blood, and there's a lot of, I don't know that the follow-up is great. I don't know that the continuation of their care is great. Sometimes their testosterone is like, 1,500. And I personally, we can expand on that as well. I think there's no need for that, right? Normal
Agreed.
physiologic levels could be up to 900. You get, free testosterone, but then they have high estradiol as a result, or all sorts of things, and they just not well taken. So it's not that I'm against these clinics, or I am, or I'm against clinics that are just not doing the right thing for patients, and I'm a patient advocate. So from your experience, tell me about your experiment and the actual problem with some of these anti-aging clinics.
No, so thank you for that introduction. And I think, excuse me, before we get into the experiment and my research project, I think what we have to give our listeners is a baseline of the role of testosterone therapy, who it's appropriate for, and
Mhm.
how we define low testosterone. Because if you don't understand these things, then you're not going to understand the results of my study. And just a quick background
Yep.
and as a urologist, you work in urology, there's multiple guidelines. There's the Endocrine Society guidelines that has a low T, that defines low T a little bit differently than the AUA, which is the American Urology Association guidelines. But per the Urology Association guidelines, you need two things to be considered what we call hypogonadal, or someone who has low testosterone, and is eligible person for testosterone replacement
Mhm.
therapy. One, the most common, you have to have low testosterone, right? So that level per our AUA guidelines is 300. We look at total testosterone, and it's less than 300. Usually we say you have to have level two levels less than 300. The Endocrine Society uses the in their guidelines, they don't give a number for testosterone. They don't give a number for free T, but they also include free T, and they say within reason low free testosterone. There's a lot of different labs for free T. There's saliva. There's there's different measurements, and that you can get lost and talk about that for hours. But for our purposes, we're going to talk about total testosterone, much simpler to conceptualize here. And the second thing is you actually have to have signs and symptoms of low testosterone, and those include decreased energy, sex drive, erectile dysfunction, focus issues, obesity. These are just to name a few. And, we know, and this is such a hot topic now, because, we know that testosterone levels, and everyone's talking about it, they decline when you get older. Starting at the age of 40, your testosterone levels go down about 1-2% a year. We know that about 20% of guys under the age of 40, 28, even under the age of 60, have low testosterone, 30% in their 70s, and 50% in your 80s. So
And
men,
Justin, when you say
go ahead.
low testosterone, are you
Yes.
referring to the AUA guidelines, like, below 300? And the reason
Yes.
why I'm asking this question, you mentioned some of the symptoms. You could be at 400 with these symptoms, right? You could be at
Correct.
450 with these symptoms. So,
Correct.
when you're referring to low testosterone, you're referring to lower than 300?
Yes, I think this was the Baltimore longitudinal aging study, and I think they used the total testosterone levels. Is where we got that data from. I have to review exactly what
Yeah.
their things were, but you bring up a good point. As we've learned, the normal testosterone level for a 30-year-old man should not be the same as that of a 70-year-old man, right? We know that your levels decline, and
Although some
guidelines
of
are
those
guidelines.
70-year-old men in Florida, they want those
Oh,
30-year they want that they want that 30-year-old testosterone, we
absolutely.
know that.
And we can get into it. And guidelines are guidelines; they're not law. And now, obviously,
Right.
we will talk about that. But there's newer data suggesting a guy who's 30 years old having a testosterone of 350 is probably low. So they're not law. And how I always tell everyone is, I use the guidelines to provide accurate and good and safe care for my patients. But it's not black and white, right?
Yeah.
Patients are, I take people on in an individualized basis, and we have to understand that. But having said that, that is our general guidelines. And, why did we do this study is because, you can tell you, Gio, you've seen it. Anyone, if you're alive and you have a pulse, you have eyes and ears, testosterone has been all over the news. People are talking
Yeah.
about it more than ever. Sales have been through the roof, and especially since COVID, the direct to consumer market has exploded. Hims, Hers, Roman, Blue Chew, those focus really on erectile dysfunction, and those have become very popular for a long time. But now we have an increase in direct to consumer testosterone. And unlike, Viagra, Cialis, which is sold, those are, although have side effects and risks, are in general pretty safe. There's obviously contraindications for things, but when we're talking about testosterone therapy, it's a class 3 controlled substance, DEA controlled substance, and there are other side effects. The major risks of testosterone therapy is it causes infertility in men. About, I think about 60% of men. Oh, I just blanked on this data. 60% of men in 4 months of
Mhm.
taking testosterone develop zero sperm in their ejaculate.
Right.
You can recover it, but obviously that's something important for people to know. It can cause polycythemia, which is increased blood thickness. Theoretically, can cause stroke, heart attack, clots, stuff like that. There used to be a belief that increased risk of cardiovascular events, a stroke and heart attack. The Transcend trial recently came out in the New England Journal of Medicine
Mhm.
about a month ago from where we're recording this, maybe 6 weeks ago, that using androgel showed that, which is the topical testosterone, that is not a thing. And the original trial that came out many years ago that
Yeah.
prompted this was a bad trial. That I'm sure you had Mokira on. I don't know if you discussed it, but he's the master of all this. He was part of that.
Yeah,
Uh,
Dr.
he,
Kira, he went in and deep about the flaws of that study,
yes,
which essentially is that many of the men who had cardiovascular disease already had pretty significant cardiovascular disease.
correct.
Those that got on TRT. Justin, let me ask you a question before you move on, because the
Yeah,
guidelines are always very interesting to me how they come about. Isn't it that the insurance companies drive these guidelines? So in other words, insurance companies say, we're not paying if it's over 300, we're paying if it's less than 300. Isn't there some contribution from the insurance industry, health insurance
I would
industry?
say no, no. It's the opposite. It's it's the other way
Mhm.
around. So
Mhm.
a group of the top urologists got together for the AUA. They were assigned,
Mhm.
top guys in testosterone knowledge. They came up with a decision. I think the last update was in 2018. Um, uh, they made a decision on what they felt were the guidelines and they gave recommendations. A group of guys based off of all the data. They did a massive data search, they had multiple
Right.
meetings. And once the guidelines come out, the insurance then says, this is what we will pay for. This is what we won't pay for. It's not that the insurance
Yeah, it's
dictates
not
the
the other way
guidelines.
around.
It's
Yeah.
it's that insurance will go based off of, well, this is what the guidelines say. So why are you treating it if it's 305?
Right.
And
Let me
and
ask
that's
you a
where you
better
come to a problem.
let me ask you a better question. Thank you for clarifying that. Actually, let me ask you a better question on that. My understanding, my experience talking to Mohit, reading the research, at the end of the day, I know you said we're not going to talk a lot about free tea, but we
Yeah,
sort of
yeah,
have to, and here's why.
yeah.
At the end of the day, you need about 2% free for anything to it. So you could have 700 total, and if it's
Correct.
not something near 2% free, it's not happening. I've seen guys 320. You know, I think I've seen 280, 2.2 free percent. They don't have any symptoms. It's just an incidental finding. So I think
Mhm.
that the name, so you could be at 350, 400, and some people would say, well, just have more total. If you have more total, you have more free. Not that simple, but yeah, let's just go along with that for now. So if the cutoff is 300 and insurance is not going to pay unless it's under 300, a guy comes in 354 for 50, but his free is low. They could be a candidate for total T
I agree with you. I
for
agree
TRT.
100%. A lot of these guys who are at that borderline, what I'll see is I'll look at their free T, and if their free T is low, I try to justify it through the insurance and say, hey, look, the free T is low. Let's do this. But also, you know, the insurance, there's ways around it, right? GoodRx is a wonderful creation out there. It's a
Mhm.
coupon that you can get very relatively cheap testosterone. That's not, it's a coupon pretty much that
Yeah.
everyone uses. And I use it for Viagra, for Cialis. And a lot of times, a lot of my guys use it even if they have insurance because it's cheaper still through the GoodRx. So, I mean,
So is
but
GoodRx a website that people can go
GoodRx
and
is a
literally
website, GoodRx. It's a website, it's an app, it's completely free, and you can use it for pretty much any medication. You just have to check, where different pharmacies have different rates. So, for example, here in Florida, I can get you 90 tabs of Cialis 5 milligrams uh, for $17 if you go to Publix, or
wow.
Costco,
But
which
you
is
still need a
amazing.
prescription. People cannot go
Oh,
in
no,
without a
no, you need a
prescription.
prescription, but you show that to your pharmacist. And you say, I'm picking up my medication. Here's my coop. You bring up the app, you bring up the website, and then they, okay, $17 instead of like $1,000 or
Now, do you
700.
put in the prescription directly to GoodRx versus CVS
No,
or
no, I
no?
send
You're
in the
not
script.
involved.
I'm not involved.
And what kind of prescription? Like, there's no pads anymore, like, so what are they looking at? What kind of prescription are they looking at?
Well, they have I electronically send it to them, so they know
Okay.
that it's in this just like anything. I write a
Just
script,
like anything, so
I go,
they
"Hey,
see
I
it in the
sent it to your
system.
Publix."
Got it.
They
Yeah, so
go,
that's
"Okay, I'm
my
gonna pick it
question.
up. Here's my GoodRx app. Here's the medication.
Excellent,
Here's the coupon." So,
excellent. Okay, great.
there's it's different for different meds, but a lot of times GoodRx, you can get very cheap testosterone if you're, you can't really afford the medication that you are prescribed. So,
Okay.
especially Viagra, Cialis, I've seen a lot of guys come in, they go, "I would love to have Viagra or Cialis. I can't afford it." I go, "Well, let's figure this out because I can get you it for cheap." So
Can you get, now the pills for testosterone or anything like that? With
the oral ones, I don't think so at this point. Injections, yes. I know
injections, yes.
injections. Injections, yes. I haven't used it for androgel yet. I'm not sure. But I have used it for, and so, if that's a little tip for our listeners that, or providers, most providers do know that, we using GoodRx is I don't understand how they make money. I don't really get it, but I'm a big GoodRx guy for sure. And once again, I'm not getting paid. The doctors don't get paid. I'm not associated with it, right? I just
Right.
say, "Oh, go use that app." So
Alright, are we ready to get into your? Because man, I wanna know. Seriously, I'm like a listener. I really wanna know about your experiment more than what I read on Instagram.
yeah, so basically, with all these side effects, potential side effects, and we understood there's a lot of information out there suggesting, guys are going to take medicines, they're not going to really think about the side effects. Especially as a male men's health doctor, male and fertility doctor, testosterone, andrologist. I see so many guys, especially in Florida, who are coming in, or even when I was in Chicago, or they come in, they're infertile because no one told them that taking testosterone was going to cause infertility. They've been on it for years, and they're like, "Well, no one told me. I went to these men's health clinics. No one told me this, or and that's that." And also, you see guys all the time. Their testosterones are like you're saying, they're jacked up. They're 2,000, and they're like, "This is what they told me to be at." I go in once a week. I get an injection. I pay $250 for the injection every week. I'm like, "What the hell are you guys doing here?" So, we wanted it with this spreading to the direct to consumer market, we wanted to understand if this was being done in a safe and thoughtful manner. So what we did was we identified direct to consumer testosterone therapy clinics or companies really online that provided state care in all 50 states. So this was not regional; it was these were national companies, and then I personally acted as a secret shopper, which I followed a set script that you can see in the supplementation of our publication. That I identified myself as a 34-year-old man. I'm 35 now. I was 34 when I did that, with symptoms of low testosterone, including low libido, erectile dysfunction, low energy. But I did desire future fertility is a big thing that is my character, and I do personally still desire future fertility. Um, and then I personally interact with all the platforms. I got the required blood work, and I went to the initial telemedicine consultation where I engaged with either a nurse practitioner, a PA, or a non-medically licensed individual.
Is
And
this what was published in JAMA in 2022?
yes, this is what was published in JAMA.
Okay.
And
I'll put
so
up the link on the show notes.
yeah, that would be great. And so basically, I did that for, we tried to do 10 companies. We ended up getting 7 companies involved, which I will never tell anyone the names. I've been asked that many, many times. I'm not going to disclose any of the company names for my own purposes.
Yeah. Yeah, they'll come after you.
Yeah,
No question.
exactly. What were the results? So my testosterone levels were 675. My normal testosterone, I think, was about 10 picograms, which was in the normal range. Maybe some people would argue. Some people say it's
Your
normal,
normal
low,
free
whatever.
your
Yeah,
free was what was that?
I think 10.
Okay. And this is your
Uh,
character, of course, the
yeah,
character
yeah.
you're
Well,
portraying.
this is my levels. No, this is real.
Okay.
This is
Okay.
my blood level. I got real levels. This is not made up. I went to a lab. Thankfully, my levels were good. Otherwise,
Sound good to me.
it would have been a disaster if my levels were actually bad. So thank God I eat healthy, I exercise, I do all the things that I try to be a model of for my patients because I feel like there's always a hypocritical thing if I'm fat, smoking cigs,
Yeah.
and not exercising. I'm like,
There
you
are a
should
few of
do all
those
these
guys
things.
in our profession, unfortunately. Great people and experts in what they do, but they don't look that healthy, unfortunately.
Well, uh, I practice my way, and I'm not going to throw shade, but that's how I like to do it. So it was
Yeah.
very encouraging to see that my levels were good. So basically,
Yeah.
we talked about normal levels. Mine were very above, well, not very above. They were good, very solid numbers. That I think 99 out of 100 people would say you do not need any medications to supplement what you have going on.
Did
Um,
you present symptoms to as your character to these places? So I do have low
yes,
libido or something. Did you
Yes,
present
I
that?
did say I said I have low libido, low energy, erectile dysfunction. Now, despite the levels being normal, and despite desiring fertility, something that we know that testosterone can compromise, 6 of the 7 companies offered me testosterone. And only half of them, 3 out of the 6 that offered it, uh, discussed fertility risk with me. None of the companies, based off of the guidelines we discussed, were using the guideline levels for diagnosis or treatment. So, that's obviously concerning. And when we're talking about levels for treatment, I'm usually a guy, the guidelines there say 450 to 600 is around really where you want to be ideally. You know, a lot of these companies were saying we want you at 1,000 or higher. A couple companies said, we want you, we'll keep, there's no
We want
max,
you at
we'll go
1,000
higher.
or higher.
And then a couple companies said there is no limit until you feel good, which is also concerning, right?
To play devil's advocate a little bit, the Endocrine
Correct.
Society guidelines sounds to me like they do give you that wiggle room to kinda come up with your own numbers. Is that and can some of these clinics kinda go by the Endocrine Society, guidelines and say, "Well, you could be as high as you wanna be as long as you feel good."
Well, I think that several things. One, I'm not going to say if someone's testosterone on TRT is like, it depends. Like, if you're injecting yourself once a week with testosterone and I try to get your labs at a mid cycle and it's 650 at mid cycle, is it not probably at 1,100 or like 1,000 when you inject the day you inject? Of course, it probably is. I mean, you got to be crazy to think. Your testosterone the half life is about 6 7 days. Test SIP, testosterone enanthinate is about 3 days. So there's different ways you can inject. Obviously, this is just for injections. But the point being, yeah, your testosterone levels fluctuate. So I mean, we looked at it. They also weren't concordant with the Endocrine Society guidelines. None of them were. So, I mean, at the same vein, it wasn't really concordant with the Endocrine Society or urology. And for your thing where you're saying, like, okay, could, you know, we just make it go higher forever? You could. And, but here's the thing, heroin feels good. Is more heroin better? No. I mean, things are, things, can help you. Testosterone can help you. And we talked about cardiovascular risk, stroke. And the Transcend study was very important because it showed that at therapeutic levels, it doesn't cause heart attack and stroke. But I don't know if your levels are at 2,000 and you're jacked up. There's a lot of studies out there on, you know, these guys who are bodybuilders and stuff like that who are at T levels that are, supra therapeutic God levels. And these
Right,
guys have higher risk of heart attack and stroke. The data's out there. We know that. Now, why? Probably because more is not always better. And,
right.
your body lives in a physiological range of things where that's where you should be. Our goal is never, we're treating a disease, we're treating a misbalance. We're not trying to exceed that, if that makes sense.
100%. I'm in total agreement with you.
Yeah.
You've seen quite a few bodybuilders die from heart attacks recently. To me,
Yeah.
bodybuilding, professional bodybuilding is the most dangerous, and I love it, by the way. I've gone to Mr. Olympia. I think I'm gonna go to the Arnold Classics, coming up next year in Columbus, Ohio.
Very cool.
I like to see a freak show. But that doesn't mean that it's healthy for those guys, and it's actually I
Absolutely.
think it's one of the most unhealthy sports that, anyone can participate in. Very little return, they actually don't make that much money, and they are putting their life on the line. So total agreement. Um, so bottom line, buyer beware. Buyer beware.
Yeah, listen, I think there's a couple things though to say. I am not against the direct to consumer concept. I
Right.
think, I have to say overall my interactions with the telemedicine platforms was pleasant. It's very efficient. But I was surprised by the gaps in their counseling and their recommendations, that I pursue testosterone. And, I think that telemedicine in general, if you check my papers, I have written literal papers on telemedicine and testosterone. Like I've given recommendations on how to practice safe, telemedicine, treatment of TRT. And I think telemedicine has a lot of benefits. You're right. Especially when we're talking about men's health and men's health stigmas. Guys don't want to go to the office. They don't want anyone else to see that they have these problems. So telemedicine is great for that because it decreases that barrier of entry to care because I can get it done from the privacy of my home. You know, there's a, we just submitted an abstract looking at direct to consumer knowledge of why younger men under 40 who use erectile dysfunction medications and well, not only direct to consumer, anyone who's used it, and above everything that they valued, we asked what was the most important thing for you for getting medicine, was privacy. Number one was privacy. It
Huh.
wasn't the cost. It wasn't convenience. It was privacy. So
Wow. Okay.
privacy is very big in telemedicine. Okay.
Mhm.
One, convenience. It is great. Access to care. If you are someone who lives in the middle of Idaho and you have no one who can do this, guess what? You now have access to care that you need.
Yeah.
So there are a lot of great benefits to telemedicine. And I don't want you to think that I am anti telemedicine or anti direct to consumer necessarily. I'm not. But, we need to be aware of the potential pitfalls that,
Yeah.
and our listeners need to understand that, and our patients, so that we can continue to improve these services that are provided. By identifying problems now, we can really help ensure that patients get appropriate, safe care. And that's, you're a patient forward person. I'm a patient forward person, and we're patient advocates. And
That's
this
right.
is, this secret shopper study is a patient advocacy study that we need people to be aware of what's going on, so that we can improve quality of care.
I love it. Thank you for that, and that's an excellent explanation. And um, hopefully there will be more, legitimate type of services um, out there where people are physicians and clinics are doing the right thing. So I'm hoping that there's more of the right type of telemedicine, direct to consumer offers out there and clinics out there. Let's move on to a paper you wrote. I have to say, you write the most interesting papers that I've ever that I've ever come across. 2018, your paper on erectile dysfunction among male adult entertainers. And your conclusion is the following: this is the first study to evaluate ED among adult male entertainers. Male entertainers between the ages of 20 and 29 had both the highest prevalence of moderate to severe ED and the highest erectile aid usage among all male adult entertainers. What, first of all, what goes into your mind when you're saying, you know what? Let's see if we could do a study on blah, like what's in you have the most curious mind I know in our field. Like, what's the premise for that?
I appreciate that a lot. So the way I do research is I I like to I used to be a more creative person, and I like to be creative, and I think of things that A would either make me laugh or make me interested. And
Mhm,
one thing that I've always tried to do research is, I we need people in the lab doing work. I'm not that guy. I did
mhm.
that. I was a biology major. I went to Hopkins. I sat behind a bench for many years. I like that stuff. But at some point I realized like I like research that I can directly talk to my patient and they can understand in 1 second, and I can use it in the office and I can use it to counsel someone, and it's very straightforward. And so how do I do these things? Sometimes I just ask people or, what are common things that they see. So for this study, I was doing my residency in Miami, and you see porn stars. I don't know if no one's ever watched porn, but if you have, a lot of it is shot down here. So you see porn stars in your office, and some of them have erectile dysfunction. Then you also see a lot of young guys who watch porn who also
Mm,
have erectile dysfunction. And sometimes they say, hey, man, I'm trying to compete with all these guys, and
right,
expectations don't meet reality. So
right.
for a long time, I would say, hey, I would love it if I could show normal guys that you don't want to be like a porn star because they got the problems just like you. And so that's how this kind of study
Or
came out to
even more
be.
so, apparently,
Or
according
it
to
or worse.
right?
Exactly. Exactly.
So
And
what are these
so,
porn
yeah,
stars do so I heard that these porn stars do, like, an injection, when they filming, like, Trimix or something. Is that
Trimix
true?
usually, yeah. Yeah, so, in our study, now, once again, we were the first ones to look at porn stars in research, really, in any capacity like this. And it was done through a survey. So a lot of people that there's inherent biases with surveys, right? So
Yeah.
you either you filled it out or you didn't fill it out, and there's some people feel strongly about certain things, and that's why they fill it out, or some people are embarrassed and they don't fill it out. So you have to understand that there's inherent biases with this. In ours, I don't believe anyone was injecting Trimix into their penis. It was really just oral medications, and that also, people said that they didn't have a penile implant, but we do know that there's a lot of porn stars out there that have penile implants, and there's a lot of porn stars that have Trimix, use Trimix. It's just a fact. We know that.
Mhm.
But
Mhm.
in our study, it was really oral medications, and it was Viagra or Cialis, and you can't even make these numbers up. 69% of all male porn stars were using medication like Cialis or Viagra. I mean, it's just a beautiful number for a porn star study. I wish I could make that up.
Are you
And
sure that number was not made up to make the
no, no.
study and the conversation more interesting?
Oh,
Come
it's
on,
just
man.
it's perfect. It was a chef's kiss moment for me. But also 60% were using them for work and personal reasons. And that's where we started getting the erectile dysfunction stuff, right? So work and personal. So more than half of these guys were using it even when they weren't having sex for work, which is
Mhm.
that's the real erectile dysfunction, right? And about 40% of all porn stars per us were had ED. We use the shim score, which you
Mhm.
described before. Mild ED is a score of 22 to 25. No ED is like it's just a score of up to 5-6 questions. The IIEF shim, same thing pretty much. What was interesting though, like you said, is the men under 30 were using the most medications, and most of those guys with ED and most of these guys with ED were under the age of 40.
Mhm.
So, I think when you're looking at that and you're looking at our data, what do you take away? Kind of what we were saying, for the average porn consumer, you have to understand that you shouldn't be comparing yourself to these guys, and because they're corking the bat, very simply. They're using
Yeah.
performance enhancing medications, and not only that, they have worse erections than probably you do half the time. But it also makes sense, right? Like how guys we talk to in our offices have problems just performing in front of one person that they like, whatever kind of partner it may be. It doesn't matter. Imagine trying to have sex with one person, two people, maybe three people in the most unconventional methods with
Mm.
like 10, 20 people watching you, lights glowing on your penis, and then everyone's looking and they're zoomed in on your penis. It sounds hard to do.
I
So,
I I I'm I so you said about 69% use something. I'm surprised it's not 100%, particularly when they're
yeah,
working and when they're being filmed, and how would you not have an implant or use
it's crazy.
Trimix?
Yeah.
There's no way, like, most people would even be able to get an erection, under those conditions.
Well, I think the other thing you have to realize is that the porn industry is a very, adult entertainers, a lot of them, it's a very transient industry. Some people do one or two show scenes and then they're done. Continuity is not that high in the industry. And we also did it in females. I don't know if you saw that data. We also looked at adult entertainers as well. And we looked at female sexual dysfunction in that population. And
And what was the
what we
outcome of that? I actually didn't see that one.
It was actually the opposite. It was, so we looked at female sexual dysfunction, which is something that is grossly under discussed, and is something that we need to really, you know, be more vocal about. 40% of women at some point in their lives have some form of female sexual dysfunction, which includes, pain during sex, decreased desire, inability to orgasm, things like that. And We found that only about 24% of female adult entertainers had signs and symptoms that were consistent or were at risk with female sexual dysfunction. And when you think about it, it kind of makes sense why. You know, the average age of the female adult entertainer that we were looking at when we got our survey was 34,
Mm,
and I said, this is a very transient industry. If you're 34 and you've been in the industry for a while, you're probably not having very painful sex, right? Like
mhm,
you're not going to stay in this in an industry that's causing you pain, discomfort, and it is not enjoyable. So I think that there is a self selection there for in that as well. There's a bias, right, in these surveys. But there's also probably a bias in the population because if you're having these problems, you're not going to stick around. What was also very interesting, and I think that's very important for all partners to understand, is that all these women found their personal sex lives more satisfying than their professional sex
mm,
lives.
mm.
So I think that's also important for guys to understand. It's like, yeah, no
Do the
one wants
guys
to
do the
go
guys
ahead.
find it satisfying when they're working and doing a film as opposed to their personal?
So we actually didn't ask that because for that because I wish we did. I don't think we did
That's a
actually
really good
ask that.
question, yeah, 'cause I
That is a great
I
question.
wonder, I mean, it's just getting a hard on and having sex and ejaculating, it's ejaculating, having sex, period, end of story, so that's always enjoyable regardless of your environment? Or, no, you know what? No, it kinda sucks, and, I do like my personal, sexual life better, I wonder.
Yeah, it's a great question. Should have asked it.
Um There is some data. So when people ask me, so clinically, and I think even vocally on social media, I've been somewhat vocal of do what you want, but be careful with porn if you have EDs. The first question I ask when somebody comes in with ED is how much porn do you watch? I believe that it's a problem for guys that are suffering for ED. There might be other problems related, but just for ED for sure. I think the problem is going to get worse as AI gets better. I think there's going to be more problems with technology and its connection to ED in men. Um, so, what are your thoughts on that? Am I exaggerating? Am I being? I am biased, not against, because I think people could do whatever they want, but I am biased towards thinking that porn watching is not a healthy thing, or at least excessive watching of it. A lot of dopamine that's released, too much of it to at a high rate, easy access to porn. So when I think you're a bit younger than me, when I was
Nope,
much
I was
younger,
there. I was the last generation. The magazine, you would find it in the woods.
or
You would
the
find a
porn
magazine or
at triple
the
X in the VHS,
yeah, the
there
back
were no
room
VH,
where you
the
yeah, you
back
go to the
room.
back room with
That's right.
yeah.
It was hard to watch porn back then,
It was impossible, man.
right? And
It was
now,
hard,
so I
dude.
see these younger guys that literally 12, 13-year-old kids that have access, then they're older and they're like, man, I don't know what, I have sexual problems. Do I need Viagra? 18, 19, 20 years old. I think that's a big contributor to the ED, that it's not always just physiological and organic. I think it has to do with that. So what are your thoughts on that?
You know, porn and erectile dysfunction is a very complicated thing. I don't think that there is so the data in general shows that using pornography does not cause erectile dysfunction, does not cause sexual dysfunction issues. There's a lot of meta analyses on this, and there's a lot of review papers. However, there are things, and it's all, there's all contextual here. I would say that there is also data that how someone feels about their porn usage inherently can cause sexual dysfunction. And I also think, how the media portrays it impacts people and how they feel about porn. And I also feel that, you know, there is such thing as excessive usage. I'm not a big fan of saying I have porn addiction and things like that because it's not really a DSM identified thing. And I think that what someone and that becomes a problem where you have people online saying, "You're addicted to porn." You're not quantifying that. If I watch porn 1 day a week or once a day, is that porn addiction for me? And then one guy says, "I watch porn once a week and now I'm addicted to porn." Like there's no context. It's how you relate to porn, I think is and pornography is a major impact on your sexual health because as we know, how you feel and how you think has such a rule if you have guilt about masturbating and watching porn, then yeah, probably you shouldn't watch porn because
Right.
it's going to mess you up. But, porn is a very good thing for a lot of people. It can be a great tool for, a lot of sex therapists use it to help, treat premature ejaculation, delayed
Okay.
ejaculation. It can, provide new inciting things for you to learn and get comfortable with your sexuality and explore your sexuality. Now I'm going to say the other thing. However, it also provides you with a lot of, you know, fetishes and things that you can't replicate in real life. So your idea of what you can do on the screen cannot simulate it doesn't, simulate reality. And
Yeah.
I think that that disconnect is a problem for a lot of people. And
Yeah.
uh I highly recommend having Dr. Lisa Paz. She's a sex therapist. She's wonderful. She's down here in South Florida. She's come on my podcast many times.
What's her last name, Justin?
Paz. She teaches at University of Miami. Um, and she has this great way of looking at it, and she describes a porn portfolio where, if you hotwire your brain to only look at feet and jerk off to feet, or you only look at boobs that are massive that, are not realistic, or an ass that's not realistic, you're going to hotwire your brain and your desire to that way. And you're not going to, you know, get off on a normal person. But she likes using this phrase of like diversifying your porn portfolio. If you keep it interesting and you change it around and and you're not just triggering yourself to one pathway, one path of desire, you're really going to be practicing pornography usage in a safer and more practical way. Now if
So
you're
there is
telling go ahead.
potentially a healthy, even therapeutic, perhaps, way of using porn if done correctly. Apparently, and
100%.
again, I'm always look. I'm in the diet world. There's diet wars. Paleo, no, no, ketogenic. No, you're crazy, man. It's carnivore, like no vegetables. The plant-based people, you guys are gonna die. There's always that. And so I'm very careful with my own biases as much as possible.
Yeah.
So I'm listening to you. I'm like, oh wow, I need to kind of change my tune here a little bit because maybe there is a positive from porn watching. The thing is that it seems to me like if it can be useful and positive, people they need guidelines and guidance. They can, on their own, right? Because it's just a big is easy access, is not complicated to get. And
Mhm.
if you're left alone, then you're just constantly watching a lot of it in an unhealthy way that's just unproductive and will not provide the health outcome that you're looking for. So that's kind of my takeaway from what you just said. It is
Yeah, and listen, and here's the thing: it's hard to get guidance on porn. Your parents don't want to talk to you about porn for sure, and
yeah,
then they don't have the exposure. We're in a new generation, like you said, that they didn't have the exposure that we had growing up to porn and these newer generations. But I also think there are people who use it too much, 1,000%. Like, listen, if you're watching porn and it's compromising your social life, what you're doing, you're masturbating too much, that and you're not having a good social life, you're not doing your work. Yeah, you probably should not be doing that, right?
yeah,
Everything is moderation, right? Like we live in a world of moderation. I don't really believe in true evils, and there's nothing like that. Are
mhm,
people getting earlier exposure sure to it? Yes. Is this inherently a good thing? Probably not. But I think all these things can be thoughtfully done, and I'm not someone who's there to jump and blame the porn industry or
sure.
pornography for
Well,
a
they're
lot
just
of the
doing their
things.
job, and there is an industry, and it's
Right.
up to us. Same thing with look, using of illicit drugs and things like that. It's always going to be available. It's been available for a long time. It's up to us to say whatever. I'm not going to use it, or I will use, whatever, and so forth. So, I actually appreciate that response. I really have to take another look at this and probably connect with Lisa Paz. That would be interesting. Yeah.
Yeah. Yeah.
Finally, testosterone and erectile dysfunction, right? So most people, many people in our profession say, look, you need you need a good amount of testosterone for to get erections. Period. End of story. Because there are receptors in the tissue, helps the tissue, it nourishes the tissue of the penis, so forth. I've seen some guys with very low testosterone, even guys on androgen deprivation therapy, with just the use of a PD5 inhibitor, whether Cialis or Viagra, who are actually getting erections and performing. So, what's the takeaway from your experience and expertise on the association between testosterone and erectile dysfunction?
Yeah, so testosterone plays an important role in erectile dysfunction. So first off, it plays an important role in your libido, your sexual desire. It has to do with arousal. It has to do with nitric oxide production, right? Which is the release of, testosterone stimulates nitric oxide, which is a molecule that releases blood, relaxes the blood vessels so that you can have increased blood flow to your penis. And like you said, it is important for penile tissue maintenance, and it does play potentially, central nervous system, responses in sexual activity and sexual responses as well. So testosterone does have an important role. But one thing that we've all discovered, and like you said, is life finds a way, man. Just to quote Jurassic Park, um,
Life finds a way. Where there's a will, there's a way.
and
I
you're right.
think it could be, honestly, I think it's just a will. Like, hey, I have prostate cancer, and ADTs, is what I'm going to find a way to make sure that we can make it happen and work. So, so on average, in most men, you would say there's a strong link. In other words, when you're looking at what's the cause of ED, there's psychological, there's nerves that need to work properly, there's blood circulation. You would say testosterone is one of the top things that you got to look at to make sure that that's optimal.
100%. Any guy who comes into my office who has erectile dysfunction, I get a testosterone level. Doesn't matter the age.
Yeah.
I automatically get it because it is a sign and a symptom of having low testosterone. Yeah, the five things that I describe to my patients that you need to get a good erection, five things.
Hmm.
If one of them goes wrong, you could potentially compromise them all. Is one, good blood flow. Like you mentioned, we talked about nitric oxide. You need good blood flow to your penis. That's how
Hmm.
you get an erection. Blood flowing in, blood coming gets trapped, it stays there. So that can be compromised, by heart disease, smoking, anything that could happen to your vessels.
Any type of
um,
vascular issue, yeah.
exactly. Also, there's something called venous leak, which is a whole other thing that some people
Can
just
te- can
develop.
can testosterone deficiency cause venous leak?
It's a good question. I'm not sure of the answer. I'll be honest, I don't
Yeah.
know.
I've seen that, either speaking with experts, or correlation, that was when there's venous leak, they say, "Look at testosterone." There's by the way, venous leak, for the audience, is a situation where the guy, gets a good erection and is in the middle of having sexual intercourse, they go flaccid without ejaculating or getting an orgasm. And so,
I'll take
the
it
idea
further than that. It's a
yeah.
little bit more because it can be seen in anyone who has issues maintaining or getting an erection, because the concept is really that your penis flows with blood. It compresses the veins. When
Mhm,
the veins get compressed, they don't have anything come out. And that's how you
mhm.
keep it's like a compartment syndrome of your penis, a temporary
Right,
compartment syndrome of your penis. But if you have leakage for other reasons that we have, you you can't maintain an erection. You can't get a good erection. So if you because that trapping of the blood is not there.
right,
So it's not
right.
necessarily always in that moment, but you're right. That can happen 100 that can happen, but it's in general. It could be for young guys, and there's really no good treatment for it other than medications and penile implants
Rings?
and stuff like that. Rings are great. Yes, very good.
Yeah.
Vacuum erection device.
Um, so blood flow, what's the other one?
Blood flow to nerves, prostate cancer surgery, pelvic surgery of any kind, diabetes, back, spinal cord injury. These are all things that can cause erectile dysfunction, and especially diabetes. People think hands, eyes, feet, but the nerves in your penis, I don't care how big your penis are, is much smaller than those nerves. So it's often the first thing to go if you have poorly controlled diabetes or you've had long-term diabetes. Three is testosterone. We've highlighted testosterone there. Four and five are supratentorial ones. Four is one I always ask, about a relationship, their relationship status, because it's arousal. Are you aroused by your partner? Now, it sounds dumb, but it's a real thing. I ask
It
guys and
is.
I go, right? I ask guys, I go, well, how long have you been with your partner? Well, I've been with her for 30 years. I love her to death, but I'm not as attracted to her
Are
anymore
you
because we're
in
getting
love with
older.
her? You love
Right,
her,
right.
but are you in love with her?
And
Literally.
yeah, yeah,
Yeah.
and that's a thing, right? Or they're going through a relationship issue and then they're not attracted at that moment because they're in a dispute or they're having a hard time. So arousal is a big one. And then five is you need to be in a good state of mind, right? To quote, Robin Williams, he said, God gave man a brain and a penis and only enough blood to control one at a time. So it's one
That's
of
right.
those things where if you're happy, if you're sad, you're depressed, you're anxious, that your cortisol levels are high, your
Yeah.
testosterone levels are low, and your penis is just not working, right? It's just not going to happen. And conversely, if you have depression, anxiety, and unfortunately, sometimes SSRIs can decrease your libido, cause erectile dysfunction. So it's a little bit of both. So those are the five things that I like to talk to my patients about when I'm talking about erectile dysfunction.
That's lovely, Justin. Justin, you've been extremely generous with your time. Though I'm envious that you're actually gonna just hit the beach right now, and
I just got
I'm
a
not.
text. I just got a text. They're waiting
I'm
for me.
gonna I'm gonna let you do that, man. So final thoughts. Final thoughts.
After everything we talked about, I think the most important thing to be is, to our listeners, to the patients out there, you know, medicine, healthcare, all these things are good, but you have to be informed. You have to think about a couple things. Why are you getting treated? What's your goal of treatment? Who's treating you? How are they treating me? And then what's the long-term plan here? And I think if you have this big picture in your mind about anything that we've talked about today, I think you're going to be a better, more educated and informed patient and give yourself the best opportunity to get the best care. And talking with the right person or feeling comfortable with the person you're talking with is a huge thing. And even if they're the best doctor in the world, like, or they have the name, if you're not comfortable with them, that's okay. Go talk to someone else. If you don't feel right with that situation, there's a lot of people out there that can help you. But being educated, being comfortable, and understanding the risks and benefits of what you're getting into, I think is a very important thing.
Lovely. How can people get in touch with you or your office?
So I am in South Florida. I'm in Broward County. I have a couple offices in up through Boca as well. But you can search me at Memorial Healthcare Systems. Google my name, Justin Dubin. You can also find me on Twitter, TikTok, Instagram at Justin Dubin MD. We also have a podcast, the Man Up Podcast. We talk about men's health topics, just like the stuff we're talking about
Mm.
today. And you can find that on Spotify, iTunes, TikTok, Instagram as well. Twitter at the man up pod at www.themanuppod.com. So thanks for
I'll
having me
link
on.
all of it up. Yeah.
Great.
My pleasure, man. Thank you so much. Enjoy the beach, brother. Thank you. Thank you for being on. Thanks for tuning in to this week's episode of the Dr. Geo